We turn you now to the latest on the coronavirus in Connecticut. Let's check out the latest numbers. So our daily positivity rate is just over 7.5%. And we know that 43 more people have died and 39 more patients are in the hospital in the last day. Also happening today, the FDA will debate whether to approve emergency authorization of the Pfizer vaccine. Nearly 3 million doses could be shipped across the country this week if the committee gives its approval today. Channel 3 Eyewitness News reporter Caitlin Nuglo joins us now live from the digital desk with how health officials in our state are planning on its arrival. So it's possible a vaccine could be just days away, Kate?
That's right, Nicole. Health officials are saying that the first shipment could be in Connecticut as early as tomorrow. But first, today, a committee of scientists will hold an all-day meeting to decide if the FDA should roll out the Pfizer vaccine nationwide. Health officials here in Connecticut say they are ready for the COVID-19 vaccine. Hartford healthcare officials say they expect to receive it within 24 hours of its emergency approval. And they are prepared to move quickly to arm their frontline workers, which could be as early as this weekend. The first doses will be given to those who treat COVID patients. Yale New Haven Health says they plan to vaccinate 29,000 workers starting next week. But first, an independent advisory committee will vote on whether to recommend that vaccine, the Pfizer one, for emergency use by the FDA. And that's what's happening today. The committee will likely look at the United Kingdom, where the same vaccine rolled out earlier this week. And 2 healthcare workers with a history of serious allergies did have reactions after being vaccinated. England's National Health Service said both people recovered after treatment, but regulators will now be recommending that those with a history of severe allergies hold off until it's fully investigated.
This is something that we should expect, news to come out every day of people reacting differently to what is basically a brand new biotech public health weapon.
Well, there are 5 other vaccine candidates in the pipeline as well, so people with severe allergies may just be offered a different vaccine. Moderna's will be available, or may be available, I should say, this month. Johnson & Johnson and some other companies could be ready as early as next year. Health officials predict that everyone who wants to be vaccinated will be able to do so by June. Live at the digital desk, Caitlin Nuglo, Channel 3 Eyewitness News.